Good afternoon, this is Dr. Do. This video is Quarantine Special Edition, video number 26. This video I'm going to talk about some movement disorder. Basically refers to the tremor. Okay, so basically the tremor can be caused by many reasons in the brain. Many regions of the brain related to this tremor. I talked briefly when I introduced about the brain problem, the cerebellum, for example, involved in the balance and also tremor, or Parkinson's disease. In the brain, there is a deficiency of dopamine, so that causes the problem, movement problem. Also, there's some Huntington's disease or the benign tremor without any cause, without any organic disease, just the benign tremor. So, this is about the movement disorder. You probably heard of it. Majorly are the Parkinson's disease and also people with cerebellum problem, particularly have the stroke, lacunar stroke, means small stroke in that area near the cerebellum, that cause the tremor. The difference between the tremor caused by the Parkinson's or tremor caused by the cerebellum is different. For the Parkinson's tremor, it's like a still or tremor. When you're not in motion, when you're sitting still, when your hands are rest still on your legs, you see the tremor. And the tremor is kind of the rolling ball like movement. So it's kind of in the same fashion or same direction. It's like you're rolling a ball in your hand. So that is the characteristic of Parkinson's disease. Cause the tremor. On the other hand, the tremor caused by cerebellum is called intentional tremor. What does that mean? It means when you try to reach something, when you sit here, you do not have tremor. When you try to reach something, your hands start to shake. And this shake is different from the Parkinson's rolling ball, like a fine movement. But the cerebellum caused the shake. It's kind of little range or big range of cause of the shaking. It's not like a fine like a Parkinson's. So this is the major difference. And the Huntington's disease associated with other movement disorder like the speech problem, because the muscle has problem, so affect the not only the tremor, also has the speech muscle has problem, so movement problem, so that's affected the speech. Some people might have stutter, and also sometimes associated with the swallowing process. So talk about the Parkinson's disease, talk about these tremor. Any problem need to go to emergency room related to the tremor, unless the tremor caused the fall. Of course, that especially in elderly live alone, because the shuffling gait of the Parkinson's easy to be tripped or stumbled and fall. That's very a risk for many conditions like bleeding or the fracture or injury to the brain. So that's the case. Need to go to emergency. Other than that, if you never had a tremor, if you never had a tremor before, but you have hypertension, hyperlipidemia, or the diabetes, you suddenly start this kind of tremor, either mimic Parkinson's or mimic the cerebellum tremor. When you try to reach something, it's called intentional tremor. When you try to reach something, you had to start to shake. This may indicate you have some stroke, even though not have major deficit or neurological deficit, probably some small. This situation doesn't warrant emergency, but at least you need to call your physician, or may just go to the emergency room, check it out to make sure it is not a major stroke. To rule out the major stroke, because if the stroke is a thrombosis process, or if it is a bleeding hemorrhagic stroke, it's ongoing. Probably start very subtle, like I said. You just a small a cerebellum injury. You just get the intentional tremor, but it might just expand it bigger. So the sooner the better. Just call your physician or go to emergency room. Make sure to rule out the ongoing process of stroke, either hemorrhagic or thrombotic. So this is the emergency situation. Other than that, if you're young, you know you have family history, you have the tremor, then it could be the Huntington's disease. And if that's the case, talk to your physician and to start some medication to treat the tremor if you need to do some job related to the steady hand. So that's the case to treat. For the benign tremor, it is usually it's not significant, can start at early age without any cause, just the tremor without hypoglycemia or without over fatigue, just tremor. So if that's the case, some of the medication can, for example, beta blocker, can treat it, can alleviate the symptoms. So you can talk to your physician. Even though I do not have any organic disease, but I just this tremor bothers me. So then call your physician, discuss with them, see whether there is some medication can treat it. The other class of cause of tremor could be the systemic disease, metabolic cause. For example, if the hypoglycemia, if you have hypoglycemia, your muscle feel weak, so that can cause the tremor. Or hyperthyroidism, when your thyroid located in the cervical area is overproduce the hormones, increase the metabolic rate, so the metabolism just in the fast, not efficient way. So people eat more, heart rate is elevated, sweating, eyes start to bulging out, and lose weight. So flushing face, if that's the case, and the tremor. So if that's the case, call your physician. We'll do the test from TSH and to diagnose whether you have the hyperthyroidism. The other tremor can be caused by the chronic alcohol use, can have this tremor. So if that's the case, you need to talk to your physician whether take some vitamins, or because if it is seriously going on long term, can cause the neurological deficit associated with this tremor. So this is the movement disorder, basically is a tremor. I hope it helps. Talk about what kind of situation you need to go to the emergency and what kind of situation you can call your physician. And basically, if unless the tremor caused by the hypoglycemia, you can drink some juice or eat some candies, can change or can treat it. Other than that, all the tremors has to be managed by your physician, even though not going to emergency room, but you have to call your physician if it bothers you and then get treated. So this is briefly introduce about the tremor or movement problem, and I hope it helps. Thank you for tuning in. I'll see you next time.